association with ILSI, and particularly ILSI here in India. We've worked together on a number of programs, and when they mentioned this particular program to me, I was actually in New Delhi. I had come for the Codex Committee on Contaminants, and we've been talking about mycotoxins actually at that meeting. And Rika mentioned this potential program, but when she actually called me to say the dates, I sort of took a deep breath because I was supposed to be in the United States. Our annual meeting was 2 weeks ago. And then I had also agreed to speak in Amritsar this last week for the food technology group. So it's all been a bit of a rush, but I'm really pleased to be here, and I thank you for the invitation. And I bring you greetings from AACC. And just to put AACC into context for you, about 100 years ago, we celebrated our 100th birthday last year. A group of gentlemen, and they were all gentlemen, sat around the table like this, and they were in the United States, and they were analytical chemists, and they were working on test methods. One of the first methods they developed was a method for moisture, and one of the next methods was a method for protein. And as their work developed and expanded, they realized that there really was too much for the same group of people to sit around a table. And they split off into 3 groups. One group was the AOAC group, and they stayed with the food safety, the microbiological, and things like that. Occasionally, they overlap back into ACC, which was the cereal chemistry group. So we took on the grains and pulses and testing programs in that area. And the third group was the oil chemists, and that group is still AOCS. And so the 3 of us operate together or separately. Sometimes we work on the same projects. Sometimes we share information. We certainly meet each other when we go to the Codex meetings. But that's the sort of history. And so ACC is really the brain science, although I have technical committees in pulses, carbohydrates, dietary fiber, proteins, gluten detection, food safety. I've got 24 different technical committees who develop methods for ACC. We don't usually take 3 or 4 years to develop our methods. We do try to do it a little faster than that. Now, average is probably 2 years by the time we've run a collaborative trial and analyze the data. But so that's where we fit into the program. Now, as the others have said, we're obviously going to cover each other's topics as we go through the day, but I was particularly struck by your previous presentation where the mention of the environment and human factors came into play. Now, if I was to consider this presentation a report, last night, this report was complete. This morning, I was working on my second report, which was my next presentation. And very early this morning, I decided I needed to put the next presentation onto the same background slides, essentially the same master slides. And the only way to do that was to copy presentation number 2 into presentation number 1 to grab the master background. Sometime in the next 5 or 10 minutes, I saved it. So what I did was oversaved my work. This presentation no longer existed. But fortunately, I did have the raw data. I was able to go back to it, and for those of you who saw me sitting there working at the computer, I was essentially repeating this report. So there's a human factor involved there. It's probably the tiredness, because I was up yesterday morning or the day before at 3:30 to go to the Golden Temple in Amritsar, but it still happens. There was nothing my computer could do. I had all of the access codes, I had all of the passwords. There was nothing it could do to say, stop, don't do this. I wish it did. So where does good laboratory practice come from? Well, it came initially usually, the stories usually go that it initiated in the United States. But in fact, it was New Zealand and Denmark who first started using GLPs, and they were in the pharmaceutical area. In the United States, it happened because the laboratory provided fraudulent data on some test methods that were for a pharmaceutical approval. So we put the skids on and a program was initiated. So why do we use them? And I think the others have already said, but we use them to get reproducible, accurate analytical results, which, to be respected, is important for laboratory success. But it isn't necessarily easy to do. We can have all these documents, we can have all of these protocols, but I think we're already starting to see that there's always gaps and there are always opportunities for these things not to happen. But, as this presentation pointed out, these are critical components of a successful quality assurance program. And it doesn't matter whether your laboratory is a sophisticated testing laboratory that uses high-end instruments, or whether you're a field inspector taking a sample from a truck, a load of seed, or a load of grain that's coming from an elevator. It's important that those components are followed, or that those instructions are followed. A couple of years ago, just before the World Cup in Brazil, I was in Brazil with a group of people, and we were working with the Department of Agriculture, and the inspector had brought in all of the test inspectors. They had a sample protocol for testing GMOs in seed. And the sample protocol said, take this size sample, and from it, take 3 subsamples. Grind the subsamples, and use a lateral flow strip to test those 3 samples. And then report on 2 out of 3. So if it's 2 positive out of 3, then that's positive. If you only get 1, then that's the negative. But what was actually happening out in the field was that they would test the first one. Why do 3 when you can do 1? So they changed in the field the sample protocol. They were only grinding 1 sample. So we spent almost a week training these inspectors on the importance of following the protocol, because at the time they were rejecting truckloads of seed. And a truckload of seed is a very valuable commodity. So that it's easy to slip up, and it's easy to slip up if the people doing the process don't understand the consequences. I think that really speaks to good communication. If the people don't understand, people doing the tests don't understand why they're doing them, then, well, why not do the first one and take the measure from that? I think to have good communication, you have to have employees who are on the team. They understand why they're there. They're not just there to tick the box and get out of there as soon as the clock passes 5 o'clock or 6 o'clock. But to have good engaged employees, you also have to have management that is good and engaged. You can't be management who sits in a corner office. You have to see what's going on, and you have to contribute to the work of the laboratory. It might not seem to be in your job description, but it's part of the success. We obviously need a strong training program, and I think that's where we're starting here. And then I think all of you will agree that you certainly need the equipment, you need the facilities to be able to do the work you're going to do. So the GLP practice, or a good food laboratory practice, is an important component of all quality programs. It includes a set of principles that essentially provides the framework in which the laboratory operates: planning, performance, monitoring, reporting, and archiving. And it's applicable in all aspects of the laboratory. And so this discussion, I'm going to talk a little bit about the basic principles with a particular focus on food testing. And then I'm going to give you the particular example that I think most of you will be somewhat familiar with. So it's a framework, performance, monitoring, reporting, and archiving. Now, 17025 is used to accredit a laboratory. And it's an example of a code of good laboratory practice. It's not the only code of good laboratory practice. To be accredited can be a very expensive initiative. What it does do is it provides you with a list of items to follow. It provides you with a roadmap. It provides you with a yardstick, something to measure your performance against. There are other GLP programs. OECD has a GLP program. But it's a program that is essentially just focused on the pharmaceutical area. And when they say non-clinical health, they mean non-people health. So it is a GLP program, and if you're working in the pharmaceutical area, it may be the program of choice. And there are equivalent regulations in the US and in the EU that follow the OECD principles. You will have a copy of these slides afterwards, so don't worry too much if you're not getting all the details. I was not trying to give you everything. And this one is actually a quick summary of the difference between the ISO program and the OECD. And again, it's there for later. Just wanted to include it so that I didn't forget. So we've already talked about some of the elements, but let's just sort of revise. A quality assurance, it establishes confidence in the reported data. We'll have standard operating procedures. We'll have statistical procedures for data evaluation. We won't just take numbers 1 to 10 and say, there's the number. We will have a documented statistical procedure. We'll validate the instrumentation. Won't just check to see if the power button works. We'll actually make sure that it tars to 0 or it tears to 0, sorry, or it provides an answer, but is the answer correct? We don't validate the instrument. We've already talked about the importance of reagents and certification of reagents. We've also talked about the importance of the analyst and training the analyst and making sure that the person. In the United States, we have a problem in the grain handling industry, particularly in the flour mills. Many of the people who've been working in this area have been retired. And they've been leaving, a nice big retirement check, and go off and go fishing or whatever. And what they've left behind is a junior technician who never made any of the decisions and is now trying to learn the process, learn the methods on their own. And there's been quite outcry, a request for training to help these people. We see it at AACC because we see it in our check sample program. And I'll say a little bit more about that later. Analyst certification, facility certification, and then tracking of your specimen, your sample, actually knowing that what you're testing represents the sample that was taken and the sample represents the bulk. So if you're going to take a sample, does it represent the shipment? Does it represent the grocery shop? Making sure that that works. And then, of course, documentation, and finally, accountability. So I think we've already covered some of these. There are processes and tools that are critical components, good communication, engaged employees. What GLP is not, and this can get confused, it's not laboratory safety standards. These are important, but they're not part of your GRP program. And for those of you who can't read it, you'll see the gentleman, he's a monk, and he's embroidering the word bread with, embossed letters, and the other gentleman says, it's a grocery list, Brother Clarence. So essentially, you don't need to embellish things. Keep it simple, keep it straightforward, keep it focused on equality, not on your safety. We're not talking about food safety here, we're talking about personal protection. Okay, so this is 17025. I'm just going to hit a few key words out of these. General requirements for the competence to carry out tests. It's applicable to all organizations performing tests and/or calibrations. It's applicable regardless of the number of personnel or the extent or the scope of testing. It's for use in laboratories for developing a management system for quality, both the administrative and the technical operations. And it is compliance with regulatory and safety requirements on the operation of the laboratory. So the standard specifies the general requirements for the competence to carry out tests. And it covers testing and calibration using standard methods or non-standard methods or laboratory developed methods. They don't have to be approved international standards that you're working with. It can be the method that you've developed in your laboratory. All of these factors still apply. And as I said, it's broken into two sections. There's the management requirements and the technical requirements. And of course there's scope and definitions and everything else. And I'm going to go briefly through the management requirements. Tell us about the organization. You'll have managerial and technical personnel who are there really to satisfy the needs of the customer. So who is your customer? Is your customer the international shipper, the person who sent the shipment to India? Or is your customer the international buyer, the one who is buying the product from you? These are the ultimate people that you need to satisfy. Usually this falls within a regulatory authority in a country, but it may also be another organization with appropriate recognition. And of course the laboratory needs a manager, technical personnel, and it needs the implementation and maintenance of that management system. You can't have a manager 1 week, manager goes on vacation. You need to maintain that management role throughout the time. So I said, this is like a checklist. What are the things that you might not think about? And it's not static, it's not fixed in time. You have to stay current with what is happening in your laboratory, or what is happening with technology, or what is happening with your instrument. You can't write the program once and not update it or keep track of it on a regular basis. And all of these activities, the policies and the systems, they have to be communicated, they have to be understood, they have to be available, they have to be documented. There will be a policy statement, a quality policy statement, and there will be a quality manual. It could be hard copy, it could be, and more likely to be a digital copy. But you need to be careful that that digital copy is protected. It can't be a digital copy that is the only copy or is not protected and available for reference at any time. And then you have to establish your overall objectives. You need to know what the major component is, and you need to have the authority sitting in your top management. It's why it's important that management staff are familiar with the quality manual. It's really their responsibility. And another reason for good communication within the laboratory, communication between the management people and the technical people. If there's a situation where communication is not good, then something can fail at a lab bench level or even at the sampling level. And if you don't know about it, then it's going to carry through your system. I think we've already mentioned documents. Well, the documents have to be maintained, they have to be controlled. You have to know where the documents are. The procedures that you develop need to be appropriate to your customer base. You can't just take a standard list of procedures. They have to be relevant to the work that you're doing in your laboratory. And as do the methods that you're going to use. You can't take a method for protein in milk and use it without validation for protein in grain or in soybeans or in pulses. You need to be sure that you are actually using a method that's appropriate for the samples that are coming in the door. And of course you need the capability and the resources. And again, all of your methods need to be reviewed. You need to make sure that if you actually need to have work done in a different facility, one that you don't have control over, that if you're running a quality program, that you understand what is going on in that contract facility. One of the things, and I try not to talk too much about my background, but for a long period of time I worked for General Mills, which is a large international food manufacturing company. And there were several times while we had an extensive capability in testing, analytical testing, shelf life testing, things like that. There were occasions, and when you're international, you need to have facilities, and you don't reproduce all of the facilities in your international locations. There are occasions where you need to use outside contract laboratories. And you need to know about their quality system. You need to validate their quality system. You can't just send the sample out and say, please test this for a GMO, for example. You need to know that they actually have the appropriate test methods to test it for GMO, and then you can trust the result that they're going to give you. The procedures back into all of your purchasing, all of your supplies. We've talked about reagents, reference materials, maybe check samples. All of the things that you bring into the laboratory as a disposable or an ongoing use, you need to have those procedures covered as well. Management side of this thing, you are service to the customer. You might be employed to regulate, but effectively you're regulating, keeping trade moving. You don't want to be the roadblock. You need to be sure that you are meeting the task, which is to verify that the buyer and seller are coming up with the right answers between them, that they're agreeing that you've got them. You really do need to respond to the customer. And so the customer should have a right to see how your laboratory's performance is going. You don't want to do this when there's conflict. You need to do this ahead of time. You need to know who the customer is. You need to understand what their needs are. Several years ago I was in Singapore and I visited one of their regulatory laboratories. I was just blown away. It was a room bigger than this, and it was GCs, lines and lines and lines of GCs. And I said, why do you need this? And they said, well, we don't grow any food ourselves. There's no land to grow food in Singapore. So all fresh fruit and vegetables arrive by trade, arrive by sea. And their commitment was that they would take the samples at 9 in the morning and they would report all of them by 5 p.m. in the afternoon. And they couldn't do this unless they had the facilities to do that. Because if you've got fresh parsley or fresh coriander, the next day it's not going to be fresh parsley or fresh coriander. There's very little you can do about it. It's different if it's a packaged good that may have a longer shelf life, but it's very important that you keep the customer in the action in the process. If you're taking samples from a large incoming shipment of grain or beans, every day that that ship sits in port is $1 cost. At one point, there was problems in China with some of the GMO corn that was being grown. And I sat and listened to the CEO of one of the largest trading companies having a very polite conversation with the customs people in China, people who had taken the sample. It took them a week to give a result. $1 million a day was the cost for that shipment. That's not just the value of the load, it's the value that's not realized by that load moving on. It's the value of what that ship could be doing with the shipper. So every day the trading company has to keep control of that is money that they're losing. So it's very important that these are, you might feel sick, go on holidays, do all of those things. The samples need to get out. The results need to get out. And I think it's very important that we appreciate that we're just a piece of the chain. And when there's complaints, we can't just let them go to the side. We need to resolve them. We need to have a procedure for resolving complaints. It may be that we have to test the samples again. It may be that they were expecting them to be tested one way, and certainly when it comes to contracts with grain and beans and things like that, oil, contract actually is a negotiated settlement, and I'll talk a little bit more about that after lunch. We do need a process for resolution. And then our first speaker talked about what we do with non-conforming testing or calibration work, and it does apply in the food arena. It is important that we resolve the problems of conforming. And of course we should expect to continually improve. I don't just mean upgrade to Windows 10. I must admit, I have one computer, the one I got here, that's running Windows 7, because I find it a much more robust software package to have when I'm traveling. I have Windows 10 on the one at home, and it gets used occasionally for fun stuff, but I've made a decision. I'm staying with the robust software system. It's nice to move on sometimes, but sometimes, as long as you can continue to get support in the older, slightly older technology. So always looking for improvement. When you have a problem, you must determine the root cause. You need to understand where the problem arose, how you can correct it so that it doesn't happen again. It's equally important to not just have the problem, not just recognize it, but to actually determine the root cause. And then you must take actions that are effective. You need to have preventative actions, you need to have improvements. Look for the potential sources. Once you've got your root cause, you need to move in. And then we've already talked about records, the importance of establishing, maintaining procedures. We can talk about internal audits. Internal audits are very important. They need to be scheduled. But they need to be audited without blinkers. You know when you have horse races, they put blinkers on the side and the audit goes this way. I was in a manufacturing facility in Europe a few years back, and I was taken on a tour of the manufacturing facility. I was shown the clean rooms, and I walked out into the manufacturing facility. It was a facility that was making tortillas, which are corn-based flat cakes. And down the conveyor belt, there should be 5 across as it goes down there. And what I was watching was that each of the outside ones was slightly falling off the side of the line. And I'm thinking, that's 2/3 of the production. Or 1/3, almost half of the production that's just not making it to the end. There's something wrong with this line. Now, I wasn't the auditor, I was just an interested visitor. But I asked some questions, and I said, and they said, oh, we can't fix it. You know, so all of this raw material was going down the line. At the same time that I was in the facility, there was an internal auditor in the facility. And I expected to actually meet this person out in the manufacturing plant. This is where all the records were coming from, this is where it was going. But she was firmly shut in an office, in a filing cabinet, reading the records. She wasn't outside, she had blinkers on, she had no idea. As it turned out, I went back and was asked to give a report, and I said to our troubleshooting quality assurance person, I really think you should visit that plant. You know, there's lots of things that I didn't see, I didn't ask, it wasn't my role to ask. Well, he went to the plant. He didn't even get it as far as I did. He stopped in that clean changing room, and he asked for a ladder. And he climbed the ladder and took the cover off the filter. And this pile of black stuff fell on the floor. So the whole system was compromised. And yet, the management in that facility really didn't see this as a problem. They were closed down shortly thereafter. It was just, if you don't have a commitment, you've got to keep your eyes open, you've got to see what you're doing. Even in your workspace, make sure you know what's happening beside you. You can't stay. So an audit needs to be, yes, follow the documentation, follow the reports, double check, but it also needs to be appropriate. You need to review it. So I've only managed to get down the first side of this. I'm going to go very quickly through the technical requirements, and these are the sign, again, that will make difference to you. So many things to consider. We've talked about human factors, talked earlier about environmental, test calibration, equipment, measurement, skills, the environment that you're working in, make sure it's appropriate, that it has lighting, that the filters are cleaned, all of those things. You work with methods that are validated. If they're your laboratory, they need to be fit for purpose, they need to be the right method. This gentleman is sniffing the cactus, and his very wise wife is saying to him, I told you it didn't smell. He's obviously not using an appropriate method. I'm not going to read through all of these. You can see them, you'll come back and do them. This is one thing, though, that I am going to touch on in the validation of your method. We have accuracy, precision, specificity, sensitivity, repeatability, reproducibility, applicability. Is the method fit for the purpose? And the people around the outside are actually representing reproducibility. If you can run it in your laboratory, is the method robust enough to run it in your field laboratories? Is it a method that can be transferred? This is what a significant core attribute of an AOAC, an AACC, or AOCS method is. These methods can be transferred from one laboratory to another. They are robust enough. There's not some finicky thing in the process that cannot be done from one laboratory to the next. It's very important that if you have a method, it could just be that you're away and another analyst is going to run the method. It's not you running it over and over. It's one analyst to the next. And it's a very important section. This presentation here talked about accuracy and precision, the importance. You can be precise, you can do it, but you can be precise outside the true value. If you go to what we really like to have, and we can't always have, obviously there's going to be some variability around the result. We'd really like to have accuracy, and precision. This discussion was about measurement uncertainty. You need to understand what the measurement uncertainty is. Whether it's just the analytical uncertainty, or whether it's sampling uncertainty, or whether it's a combination of both. We've talked about the type of equipment. This refers both to the management side and the technical side. The technical side really needs to take responsibility for the process of calibration. Reference standards may not always be available. In fact, in many cases in food, there are no reference standards. There may be materials that are close. There may be a material that you choose to use. Maybe you're sampling something or testing something every day. Then a bulk load of that, as long as it's stable, could work as your substitute reference standard. It's very important, but to realize a true reference standard, it needs to go back to a single source, and that, in the food instance, is very rarely available. Talked about equipment. Sampling, I'm going to come back and talk about again this afternoon. It's absolutely critical that we get the right sample. And the gentleman there says, do you know that no two cornflakes are identical? He's emptied the box. Essentially, I've got nothing left to sell them. He's shown it's 100% certainty that they're not the same. But so sampling is important because we're taking a representation from the bulk. We're representing the total with a sample. So it needs to be taken, and our plan, our sampling plan, needs to be based on appropriate statistical methods. We need to know how many granules or how many particles are going to be, not just in the sample that's taken at ship or the field or the supermarket, but how many samples are in your laboratory sample. You need to be sure that the sample you're testing is representative of the sample that came from the field. If you've got a bucket from the field, what is your procedure to be sure that what the sample you're now going to grind and test is representative of the whole sample? If we're going to move things, we're going to have a transfer, then we're going to also have procedures. We need to have traceability. We need to know that the sample that was taken in the supermarket is the same sample that's now on your lab bench. We need to have a system that keeps track of that. Or else, if I'm the person at the supermarket, I says, well, how can you show that that result comes from my sample? It's very important. Test reports, we've talked about those. Certificates, calibration certificates. Essentially, a long shopping list, a long list of very important things. If you're running the ISO 17025, I would strongly recommend that you have a look at this document, which is prepared by AOAC. It's actually an interpretation of many of the things that are in the ISO standard. And when you get the final copy, you'll find the website, but you can find this fairly easily. It's not freely available, but it's an important document. If you're working with ISO or you're working with a quality program, this is an excellent one to use as a side. So just back to why are we using GLPs? We're using them to get reproducible, accurate analytical results, because that's important for our laboratory success. We need to have our processes and tools. They're critical components of a successful laboratory quality assurance program. And underlying that, as I said earlier, we need good communication, engaged employees, a supportive management who understand what you're doing and who understand the support that you need as you do the work. A strong training program, which is what we're part of here, and I think has been recognized as perhaps an area that can be improved. And then you need the actual correct equipment. Now, it is possible in many cases, some of the cases of the food chain in the earlier stages, that all you need is a small box. a small protected space to do the lab tests. In fact, that's what happens at grain elevators. They are in a protected space, but it's a very small space. It's not polished white countertops, but it's clean and it has the appropriate equipment. So these are publishing in, we have a Journal of Serial Chemistry, we have a social journal, we have a strong volunteer. I have 24 technical committees. There are over 400 people who participate in those committees. They don't necessarily come to all of the meetings, but we have an online discussion program. I was pleased to see that we actually participate in those emerging technologies. We work in the area of, in fact, we have a new document that's about to be approved on shelf life studies. We have gluten testing methods. We have a collab running on microbiology, fast tests from microbiology. We cover the range of problems that any food company might face. So not just the grains, but the ingredients that might be combined with the grains fall under our umbrella. We do, and this is my little golden egg, we do have the Approved Methods system, which is an online resource. Our methods have a continuous publication system. It's not a bound volume. If you have the bound volume, it's more than 10 years old and ISO would not approve. You need to have the most recent version, which is an online. And we run a check sample and proficiency program. And I'm going to talk a little bit more about that this afternoon, but we cover a range of types of samples. So that's me finished. Happy to answer any questions if you want to know.
Thank you, Dr. Ann, for covering an overview on ISO IC 17025 and GLP. So any specific questions are there? We are, I think, on time, on schedule.
I'd be happy to talk to you one-on-one too. We've got a lunch break and I'll be around for the rest of the day. So it's, and you might have some after my next version of